clinic that I operate, we focusing on our cardiovascular patients, people that have had previous heart attacks or have high blood pressure, and people at risk such as our smokers. They're looking at changing their lifestyles and what they do, and a lot of them are agreeing they want to give up smoking but they don't know how to do it.
Nurse-led clinics have impacted quite a great deal to help us deliver like specialised and targeted healthcare to our community. It's improved patient flow quite well. Once they have their general practice management plans in place, then they've got other incentives for nurse care for chronic disease, so there's extra item numbers you can charge there. So I think the number of patients that's coming through, we try and capitalise on them coming through the clinics, and for us, yes, we make sure they have a general practice management plan. When Darlene talks about, do you want a dietitian referral? They're very, oh yeah, I want to see a dietitian. What about, do you want to give up smoking? Yeah, I do actually. I want to give up smoking. So they seem to be getting a bit more out of it. I think you have, definitely you have to have the resources in place. We're lucky here. We've got a fairly large practice. We have got designated rooms for the nurses. I've been in some general practices where the nurses just have like a desk in the corner, but we've got 2 or 3 designated nurse rooms. In general practice, yes, we all know there is a business behind all the healthcare, and you try and get the most out of your staff, and you like to do cost-effective management. The collaborating between the doctors and the nurses is really good. Over my 8 years here, it's changed dramatically.
Look, it's a new horizon for the GP practice. It's really difficult to manage like chronic diseases, which really need a multidisciplinary team care approach. Not only by myself as a GP, but also they need education for the nurse. When the nurse involved, and they contribute a lot of tasks for you, so you don't need to repeat the same thing again. The nurse can give you education to the patient.
You're getting assessed by the nurses first, so you're not holding up the queue. Yeah, I don't know if I'd ever be able to just go to what you call a private practice again without I'd have to ask whether there was a clinic nurse. I recommend that any doctor surgery now should, as a whole, look at, if it's a big surgery that you've got 4 or 5 doctors, by all means have at least 2 or 3 nurses.
Patients can come in, they can see the nurse, they can see the doctor, they can see the dietitian. It gives the doctors more free time and gives the nurses a chance to help the doctors out with their patients. Every patient needs a little push every now and again. They get the help they need.